Proper hand hygiene is a simple but effective way to prevent infections. Clean hands can stop the spread of germs from one person to another and throughout an entire community. And donning and doffing of personal protective equipment is vital in reducing contamination of healthcare workers with transmissible infectious diseases.
Personal protective equipment, or commonly referred to as PPE, is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. Personal protective equipment in the laboratory may include items such as gloves, safety glasses, shoe cover, respirators or face masks, coveralls, and full body suits.
First, wet hands with warm water. Do not allow parts of the body to touch the sink. Second, apply soap, preferably antimicrobial. Third, rub to form a lather. Create friction and loosen debris. Thoroughly clean between the fingers and under the fingernails for at least 20 seconds. Include thumbs and wrists in the cleaning. Rinse hands in a downward position to prevent your contamination of hands and wrists. Dry hands with paper towel. And last, turn off faucets with a clean paper towel to prevent contamination.
Apply a palm foam of the product in a cupped hand covering all surfaces. Second, rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotation and rubbing of left thumb clasped in right palm and vice versa. Rotation and rubbing backwards and forwards with clasped fingers of right hand and left palm and vice versa. Once dry, your hands are now safe.
First, put on the laboratory gown. Make sure to close your left gown to prevent spills, splashes, drop into your clothes and in your body. Second, put on the mask. It should cover both nose and mouth. It would be better if we will use face shields and goggles also. Do not ever take your mask and goggles when doing laboratory works. Lastly, put on the gloves. They should be pulled over the gown cuff. Always wear a gloves to protect your skins against absorption of chemicals, chemical burns, lacerations, and liquid exposure. Use your gloves properly. First, remove gloves. Avoid touching your bare skin when removing gloves. Sanitize your hands using alcohol when you already removed the gloves. Remove gown. It should be pulled from the shoulder toward the hand so it is turned inside out. Remember that the front of the gown and sleeves are contaminated. Third, remove the eye protection, face shields, goggles from the back by lifting headband or earpieces. Lastly, remove mask by touching the string only. Do not touch the front of the respirator as it will be contaminated. After removing all the personal protective equipment, wash your hands using the routine hand wash. Always remember that by removing all the personal protective equipment, always avoid touching your bare skin and always put your used personal protective equipment to the designated trash can.